Hello, I am Sean Bannister, Physician Assistant at KairWell Weight and Wellness, or KW3. Dr. Charon Donker is the Medical Director. Welcome to the KW3 Program Orientation. I want to begin by congratulating you on your decision to begin your weight loss and wellness journey. This may be an endeavor that you have been working on for some time, or this may be the beginning of your determination to stay fit and functional, attain and maintain a healthy weight, and be more active. The staff at KairWell Weight and Wellness would like to thank you for considering us as your weight loss partner to assist, educate, and guide you through this process. KW3 is a comprehensive medical weight loss center and a committed partner in your lifelong pursuit to look and feel better and remain healthy and independent. Our leaders boast decades of weight loss, wellness, and health coaching experience that they will put to use to help you achieve your weight loss and wellness goals. Medical weight loss is done under the supervision of a healthcare professional and incorporates behavioral modifications such as eating the appropriate amount and types of food, increased daily activity, planning and record keeping, and increased social support. When behavior modification fails to achieve adequate weight loss, medications can be prescribed and ultimately weight loss surgery recommended in cases where it is appropriate. We also offer health coaching services. Health coaches are licensed healthcare professionals like doctors, nurses, and physician assistants who have received special certification in applying personalized interventions to safely engage clients in health behavior change. This means that your certified health coach will partner with you to develop strategies to maintain or develop a healthier lifestyle. You will learn how to better self-manage wellness and chronic health conditions to improve your well-being, reduce the risk of health disasters, and potentially reduce your medical costs. We approach each of our clients as being unique and tailor solutions that are specific to his or her needs. We even offer virtual and in-person fitness training through our affiliated gym to streamline your efforts to increase activity and reduce stress. We understand the challenges that sustained healthy living and weight loss entail and work to develop realistic strategies for a healthier lifestyle. This is a lifelong commitment, not a quick fix for a special event or vacation. This has been proven to be the best way to achieve and maintain positive weight loss and wellness results. Obesity is a complex disease process and results not only from excess calories, but also from genetic, psychologic, cultural, and social factors. These all must be considered when developing and implementing your weight loss plan. Abnormal eating and activity patterns must be identified, understood, and corrective action taken that takes into account all the confounding factors. How is obesity determined? Obesity is determined by measuring your body mass index, or BMI, which is calculated using your gender, height, and weight. This is a screening measure for body fat. A BMI greater than 35 is Class 1 obesity. A BMI greater than 35 is Class 2 obesity, and a BMI greater than 40 is Class 3 obesity. As BMI increases, the risk for obesity-related diseases such as coronary artery disease, certain types of cancer, type 2 diabetes, high blood pressure, high cholesterol, osteoarthritis, non-alcoholic fatty liver disease, and obstructive sleep apnea increases as well. As weight is lost and BMI decreases, the risk for these diseases is reduced. Again, the obesity-related diseases are heart disease, certain types of cancer, type 2 diabetes, high blood pressure, high cholesterol, osteoarthritis or damage to the joints from wear and tear, non-alcoholic fatty liver disease, and obstructive sleep apnea. How is obesity treated? It's treated in three ways: intensive behavioral modification, FDA-approved weight loss medications, and weight loss or bariatric surgery. The first line treatment for obesity of all classes is intensive behavioral modification by eating the appropriate amounts and types of foods, remaining active by exercising 150 minutes per week, keeping a log of your eating and activity, and repeating this week in and week out increases the chance of achieving and maintaining a healthy weight. There are occasions where diet, exercise, and intensive behavioral modification are inadequate, and an FDA-approved weight loss medication can be considered. People with a BMI greater than 27 and an obesity-related condition, or a BMI greater than 30 without an obesity-related condition can be prescribed a weight loss medication if it is safe and appropriate. Weight loss medications work in various ways. Some work by suppressing the appetite, others promote fullness, and some cause malabsorption of calories. The decision to institute medication therapy is usually made after 1 to 3 months of intensive behavioral modifications, and the effectiveness of medications is evaluated after 3 months of therapy. If an adequate amount of weight is not lost in 3 months, then the medication is stopped. If there is an appropriate weight loss response, then long-term therapy with weight loss medication should be continued. The FDA medications for weight loss include phentermine, which suppresses appetite and is the most commonly prescribed drug for weight loss, orlistat, which blocks absorption of up to 1/3 of ingested fat, casemia, which suppresses appetite and promotes satiety, Contrave, which suppresses appetite and helps control cravings, and Saxenda, which suppresses the appetite. Weight loss surgery is the most effective means to lose weight and maintain weight loss over the long term. To qualify for weight loss or bariatric surgery, certain criteria must be met that include a BMI greater than 40 without obesity-related conditions, or a BMI greater than 35 and the presence of at least one obesity-related condition, such as type 2 diabetes, hypertension, sleep apnea, non-alcoholic fatty liver disease, osteoarthritis, hyperlipidemia, gastrointestinal disorders, and heart disease. There are 3 types of weight loss surgery: restrictive, malabsorptive, and combined. Restrictive procedures limit the amount of food you can consume. Malabsorptive procedures limit the absorption of calories and nutrients, and combined procedures do both. The 3 most commonly performed weight loss surgeries include laparoscopic gastric banding, laparoscopic gastric sleeve, and the Roux-en-Y gastric bypass. The laparoscopic gastric band is a restrictive procedure where a small stomach pouch is created using a surgically placed inflatable band. The gastric band is reversible. Patients undergoing gastric banding procedures lose an average of 50% of their excess body weight. The gastric sleeve is a restrictive procedure as well, in which 80% of the stomach is surgically removed, leaving a small tubular stomach. Gastric sleeve surgery is not reversible, and patients undergoing gastric sleeve lose an average of 60% of their excess body weight. The gastric bypass is a combined procedure where a small stomach pouch is created and a portion of the small intestine is bypassed. It is considered the gold standard for bariatric surgery, and an average of 70% of excess body weight is shed. At KW3, we offer two different programs for medical weight loss clients. The first is our standard medication-assisted weight loss. This 6-month program includes 14 in-person or virtual visits with your weight loss coach. We create your customized weight and wellness plan that involves intensive medical therapy with eating the appropriate amounts and types of foods, increased activity, meal planning, and record keeping. The second is our 6-month premium medication-assisted weight loss program. This program has the same features as our standard program, along with twice weekly personal training sessions at our affiliated private gym. You can contact us at 772-247-7545 for more information and to schedule your initial consultation. We require you to have a nutritional lab workup and an ECG or electrocardiogram before any weight loss medications are initiated. If you have had recent testing performed, have the results ready for your initial consultation. Regardless of the program you choose, your initial visit will consist of establishing your health, diet, and weight loss history, along with taking essential measurements such as your height, weight, and vital signs. This information is used to calculate baselines for your body mass index or BMI, body fat percentage, and basal metabolic rate or BMR. Your health history will be screened for obesity-related diseases, and baseline laboratory work and ECG will be reviewed or requested. Once this is completed, we will determine your need for treatment based on your BMI, health history, and your motivation to proceed. We will get you started in our program by collecting a 48-hour snapshot of all the items you eat and drink. This is done by taking a picture of these items and emailing them to your weight loss coach. This is to attain a baseline of your daily caloric intake and to evaluate the quality and amount of the food and drink you consume. It is essential that you complete this and that you report everything you eat and drink to help best tailor your plan for success. We will then schedule your initial consultation appointment and also send you all of our medical intake paperwork that includes forms for you to fill out regarding consent, contractual agreements, and medical history. We develop a custom meal plan with a daily calorie goal based on your basal metabolic rate and other health conditions that focuses on a daily 1,000 calorie deficit. We offer custom live and virtual personal training programs that focus on increasing your activity and improving muscle strength and endurance, core strength and endurance, and accentuate your weight loss and mood. You will be seen by your coach either virtually or in person every week for the first month, then twice per month for the next 5 months for a total of 14 visits. Your weight, motivation, adherence to your behavioral modifications, and need for medications or surgery will be assessed at each visit. Again, your weight, motivation, adherence to your behavioral modifications, and need for medications or surgery will be assessed at each visit. Again, I would like to congratulate you on your decision to begin your weight loss and wellness journey. The staff at KairWell Weight and Wellness would like to thank you for considering us as your weight loss partners to assist, educate, and guide you through this process.